Good afternoon, everyone. This is Eric Miner, and I welcome you to the Identifying Patients portion of the Biomedics Academy. Today, our focus is going to be on identifying patients for PADnet testing. We'll look at basics about peripheral arterial disease, of chronic venous insufficiency, and then how to identify those patients. If you have any questions throughout the webinar, please type them in your GoToWebinar chat window, and they'll be addressed at the end of the webinar. I'll also unmute everyone at the end of the call, so you can ask questions then as well. If you think of any questions after the webinar ends, I encourage you to call customer support. The number's at the bottom of the screen, or the email address is another good way to contact us. Diving right in, this is our agenda for today. We're going to be focusing on what is PAD, and then billing for PAD tests, what is CVI, and then finally strategies for identifying the patients. Peripheral arterial disease is a progressive circulatory condition. It results in clogged or narrowed arteries, which lead to poor circulation to the arms, legs, brain, and kidneys. Peripheral arterial disease occurs most commonly in the lower extremities, leading to decreased blood flow in the legs and feet. Additionally, PAD increases one's risk for heart attack, stroke, and amputation. 8 to 12 million Americans suffer from peripheral arterial disease. 1/3 of smokers over the age of 50 have PAD, as do 1/3 of diabetics and 1/3 of patients over the age of 70. Additionally, 1/3 of smokers over the age of 50 also have peripheral arterial disease. 75% of people that have PAD also have heart disease. As you can see, over 30% of patients with PAD who are untreated and undiagnosed have a 5-year mortality rate. Without treatment and early intervention, PAD can lead to resting leg pain, non-healing ulcers, gangrene, amputation, or an increased risk for heart attack or stroke. Like I was mentioning a moment ago, in terms of 5-year mortality, patients with PAD have a lower survival rate than patients with breast cancer or Hodgkin's disease. In fact, cardiovascular disease accounts for more deaths than cancer, infection, and trauma combined. Who is at risk for PAD? Patients who are age 70 or older, or patients who are over 50 and have a history of diabetes, high blood pressure, high cholesterol, or smoking. Additionally, patients who experience foot or toe pain that often disturbs sleep, patients whose toes or feet are pale, discolored, or bluish, patients who have skin wounds or ulcers on the feet or toes that are slow to heal, patients who have diminished or absent pedal pulses, patients who have suffered a severe injury to the legs or feet, or patients who have an infection of the legs or feet that may be gangrenous, are all at very high risk for PAD. Now, in terms of actual indications for PAD, in that case we're looking at claudication, which is pain while walking, rest pain in the legs, ulcerations, gangrene, extremity trauma, and lower extremity embolism or thrombosis. A typical PADnet study takes about 20 to 25 minutes to complete, and it enables earlier disease protection by recording pulse volume recordings, PVRs, and segmental blood pressures that are used to calculate the ankle brachial index, ABI, toe brachial index, TBI, and segmental brachial index, SBI. The ankle brachial index is determined by dividing the ankle systolic pressure by the arm systolic pressure. The normal ABI range is 1 to 1.4. An ABI of less than 1 can indicate narrowing or blockage of the arteries in the legs, increasing the risk of circulatory problems and possibly causing heart disease or stroke. Pulse volume recordings are images that evaluate the blood flow through the extremity. A normal PVR waveform is characterized by a steep upslope, narrow peak, and the presence of a dichrotic notch in the downslope. That's this small upstroke on the slide. So there are, in terms of PAD testing, there are 3 common CPT codes. The first is 93922. This is a limited arterial study. It's basically just cuffs, pressure at the arms and the ankles, and then waveforms at the ankles. The more common study is the complete arterial study, 93923, which again has pressures at the arms and the ankles to calculate that ABI, but rather than just taking the waveforms at the ankles, you get waveforms above the knee, at the calf, and at the ankle level as well. The third CPT code that's normally used for PAD testing is 93924, which is a post-exercise study. 93924s are usually used when the patient presents with claudication, but a at-rest study, 93923, came up normal. In this case, they basically perform a full PAD study, and then they have the patient walk on a treadmill for 5 minutes or until symptoms present, and then they retest the patient following that. We're going to move on to the other side of the testing with PADnet, which is chronic venous insufficiency. Chronic venous insufficiency is a progressive disease that's caused by damage to the valves in the veins in the legs. More than 50% of venous ulcers require prolonged therapy, lasting more than 1 year, and CVI can lead to more serious conditions if left untreated. Over 30 million Americans are affected by varicose veins or CVI, but only a small fraction, about 1.9 million, seek treatment for those conditions. Without treatment, those with the disease may experience progressive symptoms that can be debilitating and significantly impact quality of life. More people lose work time over vein disorders than from artery disease. Finally, 40% of women are affected by significant leg vein problems by age 50. Without treatment, CVI can lead to leg pain, fatigue, and heaviness, pigmentation changes, varicose veins, swelling, cellulitis, and ulcers. Here's a list of the risk factors for CVI. They include a family history of CVI or of deep vein thrombosis, also called DVT, increasing age over 30, vocations that involve long periods of sitting or standing or heavy lifting. Women are more prone to CVI, especially those that have undergone multiple pregnancies. Prior blood clots and superficial or deep veins are also risk factors. Additionally, obesity or a sedentary lifestyle and high blood pressure with limited physical activity are all risk factors for CVI. Primary indications for CVI include varicose veins with ulcers, varicose veins with inflammation or infection, varicose veins with pain, swelling, or edema, phlebitis and thrombophlebitis, and embolism and thrombosis in the lower extremities are all indications for a chronic venous insufficiency study. Our venous testing works using a pneumographic cuff. The patient evacuates blood from the lower extremity using a series of dorsiflexions, and then the refill time is calculated from there. A CVI study, a PAD study takes 20 to 25 minutes. The CVI study is much shorter, normally 5 to 10. Okay, moving on to capturing and identifying patients. You should have a list of marketing materials that arrived with your PADnet device. They include trifold brochures, which are usually just left best sitting out in your waiting room. They explain the disease, test preparation strategies for the patient, and then inform the patient what they can expect during the test and after the test. A lot of patients don't like getting tested because they think that it's going to hinder their day-to-day activities, so it's often helpful for them to know that they can resume their normal activities right after the test. We also have a series of questionnaires, both for PAD and for CVI. There are a series of short questions that determine risk factors and indications for further testing. Normally, we recommend that these sorts of questionnaires are handed to the patient while they're in the exam room waiting for the doctor's office. It helps them pass the time a little bit and also sort of brings to light things they might not think to mention to the doctor. Of course, when interviewing the patient, it's always good to ask probing questions. Does the patient suffer from claudication, rest pain, a history of blockages, as well as identifying risk factors like smoking history, hypertension, and high cholesterol. In addition to questioning your patient, there are also visual cues you can look for. Visual cues for PAD include cool, dry, atrophic skin, skin discoloration generally, hair loss, edema, muscle weakness, ulcers, or gangrene. Visual cues for CVI include varicose veins and reddish-brown discoloration of the lower extremities. Early detection and intervention leads to better patient outcomes. It can prevent cardiovascular complications like heart attack or stroke. Because arterial sclerosis is a systemic process, significant overlap exists between PAD and other forms of cardiovascular disease, such as cerebrovascular and cardiovascular disease. Coronary artery disease is present in about 90% of patients with PAD. Monitoring and treating patients to avoid progressive loss of leg function or even amputation is very important. Prognosis following amputation is extremely poor. 2 years following a below-the-knee amputation, 30% of patients have died, 15% have received an above-the-knee amputation, 15% have received a contralateral amputation, and only 40% have full mobility. These statistics just go to show that early detection and intervention is essential to treatment. Finally, your EMR is a powerful tool for generating lists of in-need patients. Reports can be generated based on diagnosis, such as diabetes, arterial sclerosis, trauma, or embolism. You can also generate reports or queries based on specific risk factors based on age, condition, or smoking status. If we can be of assistance in any way to help you use your EMR, please don't hesitate to ask. I did want to take a moment at the end of the webinar to highlight a couple of our offers, special programs that Biomedics is currently offering. The first is technician certification. Most states and most insurances, if you want to check on yours in particular, feel free to give us a call, require that technicians performing PADnet studies are certified by a nationally recognized body. We at Biomedics sort of can facilitate that connection. What that process would look like is we pay for the technician certification. The technician can either be trained one-on-one, they can attend the webinars, they can view the recorded webinars on our YouTube site. After the training, the technician will need to take an online exam, and then once the technician has taken that online exam, they're considered provisionally certified under the supervision of the doctor while they perform studies. Once the technologist has performed 30 studies, then they can submit those to us for review. We'll make sure there's competency in performing the tests and then issue the certification at that time. If the technologist continues with that level of output where they're seeing 10 or so patients a month and the tests continue to be of good quality, after 12 months, the technologist can get in contact with us. Again, we'll review the last 5 or 10 studies for competency and then reissue the certification at that time. One other service that I wanted to highlight is a free service to anyone currently under a PADnet contract. We can remote into your EMR and query it to find patients with primary indications. We'll filter that list of patients against the tests that you've already performed. And then we'll provide you a clean list as well as scripts so you can easily contact those patients. Just to show our support for you and your medical staff, if we find 100 patients or more with a primary indication, then we'll provide you a free month of service at the same level that you're already under. Okay, at this time I am going to open it up for questions. I have a couple of questions here in the GoToWebinar box, so I'm going to address those first. The first question I had was actually about using the PADnet as a screening device. If the patient doesn't present with a primary indication, but you still want to perform a PAD study anyway, is there a way to use the PADnet device as a screening tool to get the indication that you need? And the answer is yes. Obviously, it's better if the patient answers yes to one of our questionnaire questions. But if you have a strong suspicion there's something going on and you want to check, you can perform a study. You go into the PADnet software exactly like you're going to perform a study, except rather than performing the whole test, what you do is you only do the PVRs at the ankles. If the PVRs at the ankles are abnormal for whatever reason, then you can use the ICD-10 code I70.201, 202, or 203, which is for arterial sclerosis unspecified in the right, left, or bilateral situations, depending on the patient, and you can use that as an indication. That's an excellent question, and I recommend that you attend the Advanced Topics webinar on Friday, where we go into that in a little bit more detail. I've got another good question here. Just a second, I'll back up to the relevant slide. So the question was, are absent pedal pulses a primary indication? And the answer is no. That's another situation which that's definitely a risk factor, and I would strongly recommend giving that patient a questionnaire. Again, if the patient answers yes to any of the questions on the questionnaire, then they're due for a PADnet study. But by itself, absent any other data, a patient with diminished or absent pedal pulses is not indicated for a PADnet study. That's another very good question. And then the third question I had was about the scripts that I mentioned for the chart review service that we offer. Yes, a lot of offices do prefer to do these reports themselves over concern for HIPAA compliance, which we totally understand. And if you do this sort of report and then you still want the scripts, you can contact the patients. Additionally, we're certainly happy to provide them. Just contact us at the numbers below or the email address below, and we'll be happy to provide those to you. Okay, at this time I am unmuting everybody, all of the attendees, so if anyone has any questions they'd like to ask me verbally, now's the time. Okay, since there don't seem to be any other questions, I appreciate everyone for attending, and I hope you all have a nice day.
Thank you.